Good morning, everyone. Thanks very much for coming. The Premier will be out later today, and so this is a bit earlier than usual, so some of the numbers will probably provide a bit more colour and movement later on today. We've just got an important announcement to make, so ahead of the Premier's press conference later, just wanted to provide you with this information. I'm joined today by Lead COVID Chief Executive Liz McLeod, who will be able to answer any technical questions or operational questions you might have. First of all, can I just begin by thanking all our healthcare workers and the amazing work that they're doing on behalf of our community. And we thank them for the work they're doing now and the work they'll be doing in the future. I just want to particularly do a shout out to our assistants in nursing. They're the workhorses of our health system, really making sure that our wards run smoothly, doing some of the really tough work. And we appreciate their great commitment to their duties. I just wanted to announce that for today we've had 11 new cases of COVID-19, bringing the state's total to 481. Of these cases, 7 are from cruise ships, the Artania, the Ruby Princess, the Costa Luminosa and the Costa Victoria. This brings the total number of all cases linked to cruise ships to 176. That's 37% of all WA cases, so you can see the huge impact that cruise ships are having on our overall numbers. One of the new cases is related to overseas travel. 1 is from a close contact and 2 are still under investigation. They are all adults between the ages of 23 and 85. 10 of these new cases are from the metropolitan area and 1 is from the Kimberley. As with all cases, contact tracing is underway to ensure all close contacts have been notified and are self-isolating. One of today's cases has been admitted to hospital. And I'll just say in relation to any of these details, if we can provide you with more later today, the Premier will provide that information. So to date, we've had 19,615 Western Australians tested negative for COVID-19, with 3,972 from regional Western Australia. We now have 170 people who have recovered from COVID-19 in WA. Of the 470 cases, 52 are confirmed to be from regional WA. From the Goldfields, 3, Great Southern, 9, Midwest, 3, Pilbara, 5, Southwest, 9, Wheatbelt, 8, and we now have 15 cases in the Kimberley. The Broome COVID clinic is opening today, is open today to provide more options for people to get tested in that community. So it's great to see that's up and running. I believe we've had 6 people through that clinic already today. So in relation to today's announcement, I'm very pleased to say that our clinics, our dedicated COVID clinics, 9 across the state, are functioning well, and we had just over 400 people tested in those clinics yesterday. So from tomorrow we'll be significantly expanding the criteria in relation to COVID testing. From tomorrow, that is Thursday the 9th of April, the testing criteria changes will be available for a person presenting with a fever of 38 degrees or over, a history of fever in the last few days, or an acute respiratory infection, for example shortness of breath, cough, sore throat and so on. So from tomorrow, any member of the public presenting with either a fever or an acute respiratory infection will be eligible for assessment for testing. People in the regional areas, of course, will continue to be able to be tested at public hospitals, health services or remote health clinics. So this is a significant change and will obviously means that we'll capture a much wider proportion of the public to ensure that we continue to meet the 3 objectives that we want to achieve with this testing. And that is that we're able to find new cases, protect the most vulnerable in our community and get a great understanding of the tracking of the movement of the virus through the community. My message is clear. If you have symptoms, then please go to the clinics and be tested. Clinics over the Easter holidays will have different hours adjusted to meet with the expected low level of numbers coming through over Easter. So between the 10th and the 13th of April, most of our clinics will be operating between 10:30 and 4 p.m, although the Broome clinic will remain open between 8:30 and 4 p.m. So please check with the opening hours with the Department of Health website or call the 13 COVID hotline before you attend this weekend. And of course, I just want to reinforce the message that if you're eligible for a flu jab, please make sure that you make arrangements to get your flu vaccination for this year. And I can't stress enough, we don't want the double whammy of people getting flu and COVID-19 because we know the disease burden for these people will be very high indeed. So I know that everyone is doing the right thing. We know that people are social distancing. They are taking the measures necessary, such as exhibiting good personal hygiene. So continue to observe that over the Easter period. We want everyone to have a great time over Easter, but it's not the time for travel. It's not the time for big groups to come together to celebrate. It's a time for continuing to observe our social distancing and all the other measures that we have in place, which has produced these great numbers that we're getting each day.